Well, good afternoon. I'm Susan D'Antoni, the CEO of Montgomery County Medical Society, and I want to welcome you to another webinar in our series to assist you and your practice to respond to the challenges of practicing medicine today, especially during this COVID era. Just a few reminders before we get started. This call is being recorded, and we will post it online for our practices to access this week. We have muted participants in the beginning of this call for sound quality purposes. To mute or unmute yourself over the phone, press *6. On a PC, Alt plus A. On a Mac, Shift plus Command plus A. Our speaker today is Tim Hilton. Tim is a business development executive with PEAKE Technology Partners. He is a technology executive with years of experience creating solutions for organizations in many industries. PEAKE Technology has been a Physician Connect partner with Montgomery County Medical Society for several years. They specialize in providing technology solutions for medical practices and healthcare organizations. PEAKE is also Montgomery County Medical Society's technology provider. You may submit your questions via chat, or at the end of Tim's presentation, you may ask those either in chat or unmute yourself to ask those. We really do appreciate you joining us. We are looking for more opportunities for education to serve you. And one of those has to do with the new Montgomery County Fund for Primary Care Practices. We're putting together a briefing about that for early next week. And that particular program, the application period started today and goes through November 29th. It's a very short time frame. And so we want to make sure that our physician practices know as much about that as possible. So stay tuned for that announcement because it's going to be a very quick turnaround. So now it's my pleasure to turn this over to Tim. And Tim, thank you so much for joining us.
Thank you very much. I'm looking forward to it and hopefully it'll help. Would you mind stopping sharing so I can take over sharing so I can show the presentation? Great. All right. So first of all, thanks again, Susan. It's always a pleasure to do work with MCMS. In fact, I just came from a meeting with an MCMS practice and working with them on their IT. So definitely a great relationship that we have, and we're always glad to support and add educational value to the participants. So with that said, my name is Tim. I'm here to help you with your cybersecurity knowledge. I work for PEAKE Technology Partners, and we do healthcare information technology, as Susan said, and we're very excited to work with MCMS on this. I also have to give credit here to Ron Kendall from Unity Insurance. You're going to have some Unity Insurance information on here as well. Please take a look at our contact information here and take it down. It'll be displayed later, but it is definitely good for you to have in case you have any more questions after this. So we're going to be going through a lot here today on cybersecurity and cyber insurance. What our goal here is to give you a basic understanding of the terms and the knowledge of cybersecurity. So we're going to go over what it is, what people are targeting and what they want from you, the physical defenses, processes that you can put in place, software, and the knowledge that it will definitely happen and how to prepare for it. And then we're going to go into cybersecurity insurance and then give you some resources as well. So first of all, what is cybersecurity? Cybersecurity is how we protect ourselves while we are engaged on the internet. It is a body of technologies, processes, practices, and they're designed to protect your networks, the devices on those networks, and the programs on those devices from intrusion. It is often also referred to as information technology security. A big word that is utilized a lot in the IT space is an ecosystem. We view the technology as an ecosystem for your practice or for any organization, and this is how we are protecting that ecosystem. So what do people want from medical practices, and what are ransomware attackers, what are they after? They're after three main things, and these are the big three that people look at when they look at cybersecurity, and the big three things that they're trying to protect against. Number one is sabotage. So coming in and attempting to blackmail you by destroying your data, by making it so you can't access it, making it so that you have to pay them to fix or let you into your own data or your own network. This is a lot of times known as ransomware. So they're coming in, they're going to get in a variety of different ways, which we'll talk about a little bit later on how to protect against. And they're going to either put a encryption on your files, or they're going to take all the files and hold them themselves and not return them unless you pay them a certain amount of money. The next is information theft. They want to take information, not necessarily to ransom you, which they might do anyway, but to sell to other people. A lot of times you hear about the term the dark web. What the dark web is essentially websites and locations on the internet that are not able to be trafficked to in the normal way. So, normally you can just Google and you'll get a ton of different instances of here's the best burger places or anything like that. The dark web is not accessible that way, but it still exists in the same realm. You just have to know where you're going and what you're looking for to get there. A lot of times, people who are stealing information are selling it there. You can buy all types of different things on the dark web, and information is definitely one of them. A lot of times people buy medical records on there, buy social security numbers, a lot of information that can be obtained by getting into a medical practice. The last is espionage. While that's not necessarily the biggest concern that you should have, if you do hold IPs that are your own, or technologies or that are your own, or anything really that people would want that you are charging for that only you can do, you might need to protect against this, where people might get in simply to steal your techniques or your information so that they can replicate that. A lot of times we see that more in the corporate world and the larger healthcare space, but it is something that we wanted you to be on the lookout for. So now we're going to get really into the defenses and how we can protect your practice against these threats. The first line of defense is physical defenses, putting in place physical devices that are going to help protect your practice. Now, there's a lot of different ones that we're going to talk about, the most important of which is a firewall. A lot of times you'll already have one of these in your practice. And what a firewall is it is an instrument that regulates traffic coming in and out of your practice. So you're able to see, all right, we're seeing people are going to this website. We're going to block this website. We're going to, block emails from this place or that place. That is usually done through a firewall. It is usually a thin little box that's about 1 inch to 2 inches tall and a little deep, and it sits in your network closet, and you usually forget that it exists. But it is very important. It allows IT teams to, like I said, regulate the traffic on your network. The next is a router. So routers, everybody's familiar with. You probably have one in your house from Verizon or Comcast. And what that allows you to do is, a lot of them have a light firewall built in where you can sort of regulate some stuff and see data packets, where they're going and coming out of, if you know what you're doing. But it also is there so that you can split your internet. It's going to allow you to plug internet in and then split it onto a bunch of different cords or onto Wi-Fi. But a lot of times when you get into the enterprise level, we can integrate network security solutions onto those routers for extra layers of data monitoring and also security. The next is intrusion detection systems. These are usually in place in larger practices and places that have large infrastructure. So if you're hosting an EMR, you might have this. What this system is it allows you to know when somebody is accessing your network that you don't want. And it does this by constantly monitoring the entire network and seeing irregularities. Whereas a firewall is like a wall, this is like having a guard patrol, essentially, that's going along and checking in on things and making sure that, nobody's gotten through the wall that's not supposed to be here. The next is not necessarily physical, but it can be. We'll talk about this in a few different instances, but this is two-factor authentication. Two-factor authentication is a blanket term for having two ways to verify that somebody is who they say they are. And physically, we can do that with physical requirements for entering a network. So you might have seen little RSA keys. They're a little thing that people keep on their keychain. If you know anybody that's really into information technology, they can have that. And that is a physical defense against, intrusion, because it is making sure that that person has to have that key to be on the network. And then next is other network monitoring equipment. There's a ton of it out there. There's a lot of different ways that you can utilize it and leverage it, but these are the main ones that I would like practices to know, be able to understand that when somebody says, hey, we need to take a look at your firewall or your router, this is what they're talking about. The Cisco Meraki security appliances are one that is kind of a hybrid of a lot of these things. It is a router at its core, but it has a very robust firewall system and an intrusion detection system built into it. So that's a hybrid of called as network security appliance. We personally at PEAKE utilize them quite often, but they're not necessarily the norm, which is why I didn't have its own little bullet here. So the next is security processes. And this is something that everybody can do and get behind. And it is something that everybody should be doing and getting behind. And it's definitely the most important in my opinion, because it's something that everybody can do. So one of the easiest ways to get into a network is to just be let in. And there's a lot of different ways that you can do that. One of the most common ways that ransomware gets in is through bad processes. Making sure that email training is done, password training is done, is extremely vital. So when you're talking about passwords, everybody has passwords. They've got a ton of them. The main thing really is that you do not share passwords, and you make sure that they're strong enough and that you're utilizing different ones at different sites. There's a few different ways that you can do this. One is to simply train it and expect people to memorize 30 different passwords. It's not necessarily very realistic to ensure that people do that. So we recommend is software that allows you to store passwords securely so that you only need to enter your password into the password client in the master password that allows you to then have different passwords for each individual site, and it knows what those are. That's important because while even if you have the best processes in the world for your passwords, unfortunately, people are people and companies are companies, and they might lose your password. And that is why it's important that you have different passwords, because even the biggest corporations in America, or the world for that matter, will lose your password. Somebody's going to do it. Every day it happens. We've seen over the last couple of weeks, it happen at multiple different large health organizations and health systems where they've been hacked, password databases have been ransacked, or people just figure it out. So the best way to guard against that is by isolating it. So if only Target knows this one password, if someone hacks Target and takes all those passwords, but all your passwords are different, then you're safe. Whereas if you have Target and you use that same password at 5 other retail stores, you then need to go to all those different retail stores and change those passwords. So utilizing a software such as LastPass to make sure that you're able to have different passwords at different locations allows you to be much safer. Making sure that your passwords are strong. It doesn't do much good to make a password when someone can just put in your first name and last name and hit enter and get into the site, because people can just guess that. And that's not necessarily hacking, that's just people guessing right. And then reuse, you really do not want to share passwords. Sharing passwords is very bad processes. I've been to practices where everybody utilizes the same password for their doxy.me or for their EMR, and it is just a bad practice. It leads to a lot of different openings for security problems, the least of which is if you let go of somebody, you then They're now a massive security risk because they have access to everything. Next is email. Good email security processes are extremely important. With that is training. So the first thing is, don't click on attachments unless they are a known source. I know that that might even be roll your eyes for basic cybersecurity, but you would be shocked at how many people just do it. The harder part is in recognizing phishing attempts and training phishing attempts because they're changing all the time, but it is important to do. We've seen it time and time again that people just are not trained to identify phishing attempts, and they're becoming more and more sophisticated. For example, there are people who will change their names on Outlook, the names that are displayed, so that they display as, for example, a practice owner, and send emails from their email, and it will look on Outlook as if it's coming from that person. The only difference is going to be that their email is different, but not everybody's going to notice that right away. A lot of times they'll simply see, hey, this email is from Tim Hilton. Let's open it and do whatever it says because they're the owner of the practice. They, like I said, have become very sophisticated. Making sure that you put in place a training program that allows you to alleviate that is extremely important. The last is physical media. Unfortunately, the healthcare world is still utilizing CDs for some reason. I don't know why. I do know why. It's bad reasons, but it is what it is. You might have to do it anyway, and you might be forced to. And I apologize for that. And I wish it was we were in a better place. But we still need to secure those physical devices, making sure that you have a good process of these. When a CD is made, it is kept in a secure location and it is destroyed correctly, not just broken in half, not just chucked in the garbage, but shredded or disintegrated is extremely important. It just happened 3 weeks ago where somebody in Michigan left 10,000 medical records on a CD and it got left out in an office and it got stolen. And it's a big HIPAA violation. And it is also, not good for those people whose information got stolen. So making sure that you have a process in place of, here's what we do with physical media. Here's what we do with it when it's done and we need to destroy it. And here are the very few instances where we utilize physical data storage mediums is important. The next is security software. A lot of this is very important to have. Antivirus software is extremely important. It is. And it is a fact of life that you need to have it on your devices. Even in your personal life, you should have some sort of antivirus software. But there's dozens of them out there. Most often, it is associated with device endpoint security. So PC, Mac, they're going to have security. I put this out there whenever I do this webinar. It's a big rumor that's always been going around. Yes, Apple equipment is susceptible to security breach. The only reason why people think that it is not is because people didn't care enough to try very hard because of how small of a segment Mac has. People really usually care about hacking into businesses, and organizations normally don't use Apple, but that is changing. So people are, trying and caring about working in Berkeley, which is what runs Macintosh OS. So that is a rumor. I always try and dispel that when I give this talk. So definitely have an antivirus software on your Apple machine. We had already started to talk about LastPass. That is a type of software called a password locker. So a password locker is something that holds onto your passwords, and you only need to log on to one thing every day, and that remembers your passwords and automatically puts it out. A lot of times it's used in conjunction with two-factor authentication. So a password locker, you'll sign on to Windows onto your domain, for example. That will now know that it's you because it'll send a push notification to a cell phone or some other type of two-factor authentication to say, hey, it is actually me. And then it'll know it's you. And then all your passwords will already be saved, and you'll be able to open all your apps and all that kind of stuff, and you won't need to worry about it, and you won't need to remember 300 passwords. That's sort of an ecosystem and environment that we encourage creating. Yes, if you lose your master password, that's a problem. The way to avoid that is not ever use that master password for anything else. Have a work dedicated one and remember it, and don't make it easy. And we put in place strict protocols with master passwords. In the end, if you make it too easy, it doesn't matter if it's a master password or not, people are going to be able to get it. So getting into two-factor authentication a little bit more, there's a bunch of different ways that you can do this. Two-factor authentication comes in one of three forms. It's either something you know, something you have, or something you are. So something you know is like security questions that you get for all types of different things, and RSA tokens. So RSA tokens will sometimes put out a number that you type in, and that's something you know. That's not something that most practices need to ever worry about. And RSA is a brand, so it's not necessarily, it's not an abbreviation for anything, so you don't need to worry about that. The next is something you have, which is an RSA token, for example. Something you have is access to an email. So if you have two emails that you send notifications to unlock the ability to do it, that is exactly a good thing to do. And the next is apps for your phone there. So for example, at PEAKE, we use Duo, and it sends me a push anytime that I want to log on to our network and access data networks. And essentially it's an app on my phone that I get sent a message saying, hey, you need to let yourself on. And I open up my phone and I hit enter and it lets me on. It's very easy to use. I recommend everybody does it. You should do it for yourself for personal use, but you know, it is what it is. And then the next is something you are, so biometric data. So, you know, fingerprint scanners are a real thing. That is something that can be used as two-factor authentication. There's also all types of other ones that are out there, but more than likely your practice will never need to worry about it. I put that in here just for completionist's sake. So backups. Backing up your data is important. It allows you to have somebody take your data and put you in ransomware and not really need to care about it too much. You do want to get it back and you do want to unlock your encrypted files, but having a backup means that you're not actually shut down the entire time. You are able to go back to your backup, start working, and keep working while you solve the crisis of somebody has access to your data. We utilize on-site and off-site backups. You know, there's a lot of solutions out there. We recommend Datto or Veeam for on-site, and then there's a variety of private cloud solutions. Now, I'm not talking about simply saving files in two places. These are devices that are automatically taking snapshots of your entire network every few minutes, every few seconds, and they are backing up that data constantly and keeping that in place and, you know, making sure that it is up to date so you don't have to worry about, oh, I forgot to save that to my Z drive or whatever else. They're also very separate from access from people on your network. You do not want people being able to log into your backup on a whim, because if they can log into the backup on a whim, if they are compromised, then the backup is compromised. So there are also some other softwares that are commercially available, such as CrashPlan, which we do recommend. And those are good. The problem with things like CrashPlan, they don't normally store data for very long term. So another benefit of having a dedicated backup, such as Datto or Veeam, is that I can go back and look at a snapshot of your network 3 months ago. So let's say someone deleted a file and they did so 2 months ago and they realized that, oh man, I need that file, but I deleted it months ago. You have a good backup solution. You're able to go back and say, all right, where is it? Here it is. I'm going to bring it forward to now, pull it from the backup, and we have it. Softwares like CrashPlan are great because they are taking snapshots constantly, whereas backups, normal backups, are usually end of night thing. They do it and for the whole day, that kind of thing. But CrashPlan also only really holds that data for 3 days. So while it's very accurate, it doesn't have a good longevity. So it's a give and take. Normally we recommend a hybrid or a combination of both of those. So here's the bad news. This is going to happen. to a lot of people. It happens every day. Even with the best security out there, it happens. There's plenty of health systems that do everything correctly, and they still have this happen. What we need to do is make it as hard as possible, because in the end, it's easy to do. At a lot of different small businesses and practices, you're kind of just doing Russian roulette a lot of times, because a lot of they do not have security in place. So why would I go try really hard at a practice that's tried to put it in place, firewalls and all these other things, when I could just go to the practice next door that is not. So that is what you can do, but if they really want to, they're going to probably figure out a way in. So it can be devastating if you're not prepared. So preparing for the worst means having backups, making sure that you have a contract with an IT managed service provider that can help through the process and also fix any problems that arise. Performing security risk assessments so that you know where your risk areas are, and making sure that you identify problems before they occur. Having cybersecurity insurance, which we'll talk about a little bit more, and train your staff and take it seriously yourself. I cannot tell you how disheartening it is to spend the money, put in place good security, all that stuff, and then have somebody just emailing passwords on an unencrypted email, just typing it out. It is extremely frustrating because it's something that is so easy that everybody can do, and they just choose not to a lot of times. You wouldn't just leave the keys to your car on top of your car in the middle of a parking lot. So those are the kind of basic things that you should be looking at trying to avoid. So here are some resources. ForcePoint is a security company. They do a great job. They make a lot of very good network security devices. So definitely take a look there. Trend Micro is who we utilize for antivirus software. So definitely take a look there. They're a great platform, and they have a lot of very good resources. Cisco's are arguably the biggest name in cybersecurity or in security appliances. They have a lot of great resources that you can utilize and leverage. So definitely take a look at it. So next is why buy cyber insurance? Healthcare is a targeted industry, and small practices are a top target because of how easy they are, because a lot of them just do not take cybersecurity seriously. So there's all types of different breaches, such as non-electronic privacy breaches, and patients want to trust you with your personal information, and if they see that they can't, they're not going to be your patients for very long. Now, 4 in 5 physicians have experienced some sort of cyber attack, and data breach claims can be as high as $400 per patient record. So there's a lot that the policy covers, and if you want more information on what it exactly covers, please reach out to Ron and Unity Insurance. That said, I personally was amazed at what it covers. So what I would recommend is taking a look at it, but it really covers everything that happens with it. There's a lot of soft costs that you do not anticipate. This isn't just going to cover the ransom. It's going to cover the downtime. It's going to cover your hours to remediate. It's going to cover lawyer fees. It's going to cover a lot. So definitely worth taking a look at with Ron. Yes, please use the chat function to submit questions. That would be great. So as we said, there's a lot of things that you can do to manage that risk, which is, contact outside security. External IT is always important to have. Having an IT person in-house, and once again, cyber education for employees, have a training program, and have an in-house cybersecurity policy. All right, so that is it. I know I went through that pretty quick, but if you have any questions whatsoever, please feel free to ask. You have me for as long as you need me. I want to make sure that everybody's comfortable. If there was a specific thing that you wanted to learn more about, please ask, and I'll do my best to answer.
So we do have a question in chat. Can you recommend an antivirus software?
Sure. So like I said, we utilize Trend Micro. They are very good. I tend to not recommend McAfee. I don't like it at all. And while Norton is good, I don't necessarily think that Norton is always worth it. There's a lot of enterprise level security softwares that are out there. And then making sure that you're paying for Windows Defender and having Office 365 comes with good Windows Defender. Making sure that Windows is up to date is extremely important. Paying for Windows also important. So Trend Micro is our usual recommendation.
All right. Are there any other questions? You can unmute yourself and ask Tim directly if you would like to, or just submit those questions in chat. So Tim, I have a question. In the news, we read often about these very large breaches, which then result in either huge fines or huge amounts paid to those people that develop ransomware. I'm just curious, what were usually, what caused those breaches, or where was the Achilles heel, if you will, in those practices or in those healthcare organizations? Is there a trend that you've seen, so that our practices would know that that was a particular area that was a weak point?
Sure. So I can only speak for practices and health systems that I've been directly involved in when these things have occurred. There are, I have worked in a lot of them. Not any of the ones that have happened recently, but I can speak to what have happened before. A lot of the recent attacks, which there have been an absolute ton in the last 2 months, if you've noticed, those have been targeted attacks at the health industry because of how behind healthcare information technology is. I would argue that healthcare information technology is 10 to 15 years behind where it needs to be. It is crazy. In my experience, one of the biggest vectors through which these people are getting into practices is through poor policy and poor processes. They're getting let in is the biggest one. It's very easy to just go out and buy a firewall and put it in place. It is harder, though cheaper, and honestly easier. That was a kind of confusing answer, but to just put in place good processes and train people correctly. I was involved in 3 healthcare networks having big issues. I was at that time working in disposal, so we were let in on the back end because we had to go through and destroy all of their hard drives and destroy all of their compromised equipment. But of those 3, all 3 of them were ransomware that was let in through email and through people giving out their passwords. So that is the number one biggest thing that every practice should focus on, is training your staff not to share passwords between themselves and with anybody else, making sure they have dedicated passwords for all of their different apps that they utilize, and making sure that it's not, there's a term called a root. So if you have a password that is, let's say, XXYY, and then you add in the app name and then a number or something like that, and you're using that to differentiate, that's not enough. They need to be unique and not have a common root. That is extremely important. And it's not hard once you get it going, but it is hard at first. It is, because people are not used to having to memorize 30 different numbers that they have to recall all the different time, because we've gotten so used to not having to memorize phone numbers, which is a weird problem to have. But remembering different passwords and putting in place these processes is extremely important.
So one other question related to COVID. Many employees I know of some practice managers and others who have been working remotely. Maybe there's a little less of that now, but certainly as we see this climb in cases, we may have staff that are reverting back to working at home. Do you have particular recommendations or particular concerns that practices should address in that sort of situation? And so what would those be?
Yes, so that is a great question. So you need to make sure, one, that you, once again, have processes in place and training in place on how to do this securely. You need to be making sure that people understand, no, you cannot access the EMR from Starbucks or from sitting outside of Starbucks or from on a public network. No, you should not be accessing any type of PHI on a public network. You should be, your computer, if you are not utilizing an MSP like PEAKE, where we would be putting in place a dedicated network for your company to utilize, that they would then be able to log into and have a VPN, virtual private network. You need to make sure that you have very robust security protocols in place, that they're only connecting on a secure network that is a home network, for example, or in your office. Making sure that their home network is secure is important, and making sure they're, once again, not going in to a public network to access patient data. You also, I would recommend, even if you don't utilize an MSP like PEAKE to put in place a network with a VPN, you should do it anyway. It's not an easy thing to do, so you should probably have somebody who's an expert in the field do it and set it up. But it alleviates a lot of that, because essentially when you create a virtual private network, it walls off that PC when it's connected to apps that are hosted within that network. Yes, I think that's the number one thing, is making sure that you have the processes in place to make sure that people know how to access these things safely from home or from wherever they're accessing them from.
Just an experience. We have a VPN in the office, and it has worked extremely well. We've had very little issues, and it was set up before COVID, and has enabled the medical society staff to work as if, of course, we were sitting in front of our own PCs at the office. So PEAKE set that up for us, and it has worked extremely well. So if anybody's still looking for a solution, that has certainly been a really effective one for us. So are there any other questions? All right. So I would like to again thank Tim for joining us today. As I said, PEAKE has been a partner for quite some time, and they are at the ready to be able to answer your questions and try to provide solutions, certainly for your office environment and for even larger healthcare organizations. I also want to remind you of all of the COVID-19 resources that we have online at montgomerymedicine.org /COVID-19. Carissa Miller, who's on the call, has done an outstanding job keeping that up to date. And we pride ourselves in having very current resources for all of our practices. Also, just a reminder, we had a few people join us a little late, is that there is this new Montgomery County primary care grant program, and it launched today on November 18th. The application period is through the 29th. We are setting up a briefing about this program, which will be early next week, either Monday or Tuesday. And so I would encourage you to look for that information in your inbox and make sure that you join us for that. One of the things we're doing is making sure that we understand the definition of primary care. And we know that a lot of specialists like rheumatologists, cardiologists, OBGYN do a lot of primary care in their practices. And so how is it defined with regard to this particular grant program? So we're all learning very quickly, just as you are, but we continue to be a resource to you and kind of hold your hand through this process of applying. We've already had a number of physicians contact us today about this particular program. So with that, just are there any final questions? All right, well, we want to thank you again for joining us for this webinar. That we will make this available via our YouTube channel. Don't forget to subscribe to our channel for other educational content, including a webinar on many, many topics that we've done since the beginning or middle of March or so. So thank you all for joining us. Please remember that we're very open to receiving your feedback about what types of education that you could use in your practice. All you have to do is send me or Chris an email. That would be sdantoni@montgomerymedicine.org or kmiller@montgomerymedicine.org. So thank you all for joining us. I hope you have a great afternoon.